Ladies and gentlemen, the press, the friends from media, and my distinguished panelists of the day. I would introduce them a little later, but first let me start with a brief introduction to the today's session. I would like to welcome all of you to the big debate which is going to happen today on vaccines, vaccinations, their interrelation and correlation with public health in the times of pandemic which we are going through. Today's session is going to be the first among many sessions which are going to happen in run-up to the PHIC 2021. That is Public Health Innovations Conclave, which is going to happen in November between 12th and 14th. And these live sessions, which are going to happen, probably 3-4 of them, and you will get actually a detailed list of them a little later, are going to be organized with participation of experts from multiple disciplines to throw light on burning issues, especially in relation to the current pandemic and also the after effects probably it would have and how to deal with that. And also to clear the air of ambiguity and give answers which are concerning common public to policymakers and healthcare workers to political leadership of the country. Now, I don't think there is any one person in the country or in the world who is not concerned with the current status of COVID-19 and also the vaccine. This and more sessions to come will be a prelude, as I said, to the Public Health Innovations Conclave. Before we move into the discussion or the debate, let us get a little big picture and also some facts which are surrounding the vaccine, vaccination, and public health. As we all know that the speed of development of COVID-19 vaccines was surprising to many, including to those who have developed, that is, the researchers. Vaccine development, as we all know, takes quite some time. In fact, in some cases, it may take a decade or more, but there were a number of factors this time that made it moving at a lightning speed. Political commitment from almost every country and also the money which was available has made actually this happen at that kind of lightning speed because everybody wanted some or the other way to control the pandemic as soon as possible. Combined with the best of the minds, scientific minds in the world, working towards one common goal has resulted in this extraordinary level of collaboration and cooperation across borders and between institutions. So this is the answer probably to most of the questions which are emanating that why and how we could get vaccines so fast into the commercial availability. Scientists around the world are still working because it is a work in progress than ever to develop and produce vaccines that can stop the spread of COVID-19. Since the emergence of coronavirus in December 2019, 20 vaccines have started to be rolled out in countries worldwide, and there are more than 300 candidates in pipeline at various stages, preclinical, phase 1, phase 2, phase 3, etc., etc. And as we all know, about 8 of them are being popularly used in various countries that you all know. I need not probably repeat. That is Pfizer, Moderna, Sputnik, etc., etc. Now coming to even broader picture in relation to what is going to happen. If we recall, in May, World Health Organization has made a statement that the pandemic will be over once we reach 70% minimum coverage in vaccination. But if we look at the statement which was made a couple of days back by Kluge of World Health Organization, he has acknowledged that the situation has changed due to new, more transmissible variants like Delta, Mu, etc., etc. Epidemiologists in this kind of scenario are equivocal to say that it is unrealistic. It is unrealistic that herd immunity can be reached only with the use of vaccines. So they remain very crucial to contain the pandemic. And one more fact is that a successful vaccine strategy is the cheapest policy path to normalization, economic normalization. Without vaccine, I don't think we will ever be able to normalize our economy. Just to give a very brief tidbit that if we are going to vaccinate entire population of the world, that is 7.5 billion plus, the welfare cost of universal jabbing is estimated to be something like 0.6 to 0.7% of the global GDP. But if we are not going to do that, the cost is going to be enormous. That is almost like 1% of world GDP per month. That is what is going to be the cost. And when we come to probably the variants, which is also something which is buzzing, a Delta variant is still cutting like a buzz saw through almost every country, pushing us back on our progress against COVID pandemic. Other prospective variants like C1.2, or we popularly call it as Mu variant, are equally worrying. So probably we'll also get some answers to these questions from today's distinguished panel. Even with Delta variant, the vaccines are still doing what they had to do, and what they had to do is actually to stop the death or the severe infection. I think that message had to go very, very clearly, because there is a lot of ambiguity, and also the message is getting lost, and the people are unnecessarily having expectations beyond what vaccines can do. Unless we get into that reality, probably the vaccine hesitancy is going to go up, right? So those are also some questions which are going to be answered by our distinguished panelists. And then to look at the current scenario, luckily India, a couple of days back, has crossed that very significant number of 75 crore vaccine doses being given to the people of the country. Yes, that's a very significant one. It is laudable and we should be happy about it. But at the same time, it is only a beginning, if we had to say so, because still 3/4 of population is not at vaccinated in India, and about 2/3 of people worldwide are still not vaccinated. That means, there has to be a significant progress in terms of availability of the doses, scalability of actually the technologies, and also probably the alternative technologies which are to come, making it possible that in shortest possible time we vaccinate the world and finally get away from this. And of course, we also have today in our panel a modeler probably who can give probably some good news about when this is going to finally end. So with those few words, now let me actually introduce today's panelist, uh, Professor GVS Murthy. He is the director, Indian Institute of Hyderabad, and he is also the Vice President of Public Health Foundation of India and visiting professor at London School of Hygiene and Tropical Diseases. And his work revolves around improving global health and fostering international partnerships to improve health status of the population. Welcome, sir. And my second panelist today, Dr. Mathu Mathukumalli Vijayasagar Garu. He is fellow of Royal Society. He is advisor to Nihilent Limited. He is chairman Scientific Advisory Board Map My Genome, and most importantly, he is the National Science Chair and Distinguished Professor, Indian Institute of Technology, Hyderabad. Welcome, sir. My third panelist, Dr. Mukherjee. He is the Senior Interventional Cardiologist from Medicover Hospitals, and he is also the Director, Pulse Health Center, and founder, IMA Kukatpalli. One thing definitely I had to say, Dr. Mukherjee had been in the forefront of creating the awareness among the populations about the pandemic and also the vaccines, etc., which has significantly contributed to improvement of the situation. My other panelist, my good friend, Mr. Deepak Sapra. He is the Senior Vice President and Head of Pharmaceutical Service and Active Ingredients, Dr. Reddy's Laboratories. In fact, he is the CEO, API and Specialty Chemicals. And popularly, I keep saying that he is the man behind Sputnik in India. So, thank you, Deepak, for coming over here. And with that introduction, Now I request panelists to make a brief opening remarks about their core areas so that we can start the question answer session a little later and then open the session to all the media friends and also other people who are participating both in physical format and also in digital format so that they can actually ask their questions.